Hi, I'm Dr. Joshua Emmanuel Galvez, and I want to talk about coronary angiogram. For your information, that the patient who might undergo this procedure, a 45-year-old male, heavy smoker, and obese, came to my clinic. After playing tennis, patient suddenly developed severe chest pain, described as chest heaviness, associated with cold clammy perspiration. Patient was immediately brought to St. Luke's emergency room. 12-lead ECG resulted to ST elevation, which is suggestive of acute myocardial infarction, or known as heart attack. Patient was then immediately advised to undergo emergency coronary angiogram with possible angioplasty. Coronary angiography. This is a test used to diagnose coronary artery disease using catheterization procedure. Like any other living tissue, heart muscles need blood and oxygen supply for their normal functioning. The blood vessels that supply blood and oxygen to the heart muscles are known as coronary arteries. Cholesterol deposition on the wall of this artery is called plaque. Formation of plaque in these blood vessels cause narrowing of the blood vessels. This can affect one or more arteries. When arteries get narrowed, they are not able to supply adequate amount of oxygen to the pumping heart. This lack of oxygen to heart muscles causes chest pain or angina. When arteries are narrowed in excess or when a blood clot forms on the plaque, the arteries may become completely blocked, causing death of the part of the heart muscles. This is known as the heart attack. What is coronary angiography? An angiography is a reliable procedure to detect blood vessels. It is an X-ray that visualization of the heart's blood vessels. During an angiography, a flexible tube called a catheter is inserted through the blood vessels of the thigh or the arm towards the blocked segment of the heart artery. A dye is injected through the catheter so that X-ray images of the heart blood vessels can be obtained. If the angiography does not show a blockage, the patient is allowed to go home after the test is complete. However, if the angiogram shows blockage, the doctor will perform a coronary angioplasty after visualizing the details of the block. What is coronary angioplasty? Coronary angioplasty is a medical procedure which opens up blocked blood vessels, thereby restoring blood flow to the heart muscles. Coronary angioplasty may be needed to reduce chest pain caused by reduced blood flow to the heart muscles. These proceeds sometimes done as an emergency procedure after an angina or heart attack. Once the blockage has been identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, establishing the flow of blood in the artery. After the blood vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may receive coronary stent angioplasty. This is a small tube made up of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as inserted into the position. When the balloon is inflated, the stent expands and locks itself into place. the deflated balloon and catheter withdrawn, leaving the stent behind to hold the artery open permanently. Post-treatment, a pressure bandage is applied to the artery to prevent bleeding. One need to lie down for several hours for signs of bleeding or chest pain is monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.